A little bit about me. So I'm a clinical social worker. I'm also a professor of social work at the University of Wisconsin in Milwaukee. But everything I do, all of the work I do, all of the research, all of the families, all the community is completely guided and embedded in all of the clinical training and clinical years of practice that I had as a clinical social worker in neurology. I started out working in Huntington's disease, neuromuscular, ALS, Alzheimer's. So I have a wealth of clinical experience that has really just completely guided everything I do. I want to say off to the side here, there's a picture. This is a family guide that I wrote coming up on almost 10 years ago. We do have an updated version. I'm sorry, I don't have the updated picture, but it does exist. This is a guide that I wrote for families after I did the first study of children and youth living in families with ALS in the United States. And we took all of that information, we took all of those interviews, we took all of that survey data and combined that with all of my clinical practice and wrote this book. And this book is freely available. It's freely available at the ALS Association's website. It's freely available on Global Neuro Y Care, which when I talk more about it, we want people to be able to download it, use any and all materials in it. But I put that up there on this slide to say that really guides my presentation to you all today. Something that I am incredibly intentional in doing and recognizing that obviously I am not a child or a youth. I do not have a family member with ALS or another Huntington's disease or Parkinson's. So I always want to be really thoughtful about how we start our conversation and whose words and whose voices we privilege. And this is a statement by a young woman who I was interviewing for my dissertation research in Huntington's disease. And she says, if someone says, how's your mom doing? I'll say, oh, she's doing all right. But maybe it'd be nice if someone asked me how I was doing, like, because I'll have an answer. And it's profound to me because she's 16 years old, or was at the time. She's definitely not 16 anymore. But she had quite an answer. And as we move forward and talk about all the things that we can do to support our children and youth and why we need to think about that and how we talk about ALS to our children and youth, I think it's incredibly important that we just start with the words of our children and youth themselves. So what do we know a little bit about research on families and illness? So, you know, Angie asked that I come and talk with you all about programs and supports and services. And I just want to ground it a little bit in some of the research that I have been doing, my colleagues have been doing. And we know quite a bit about how illness impacts children and youth, regardless of the disorder. This is not specific to ALS. This is across disorders. And what is absolutely critical is that when children and youth are not talked to, when they're not told the details, when they're not given information, this really results in a lot of anxiety, fear, concerns, guilt. We also see children and youth really struggling with coping skills, difficulty with self-isolating, feelings of guilt and responsibility. And it really underscores the criticality of having correct information as well as just basic information provided to our children and youth. Because whether they're living in the home with you, if you have the illness, or maybe your grandma or grandpa and they're down the street or even a state away, they know what's happening, but they don't have the details. And it's really important to get for you all, for your family, to be as supported as absolutely possible in having these conversations and sharing this information with your children and youth. So one of the things that I have done a lot of work on, along with several other colleagues, is how families talk about illness, right? So One of the things that we have found, particularly in our ALS research, is that families often struggle with the conversation. And some of you might identify with these, some of you might not identify with any of them, which is absolutely fine. We want this to be as kind of a broad conversation as possible. But we know from our research that families really worry about crying or being overly emotional in front of their children or grandchildren. And so that leads them to want to protect their kids or their grandkids by saying, I don't want them to have to be exposed to this. So we're going to keep it a little bit away from them in order for them to be kind of safe from that conversation. And what we know is the more you don't share with them, the more anxiety and fear and worry they experience. We also know that there's a lot of cultural expectations about what you do and don't share. A lot of this is bound in how you were raised, or what your social structure says, or even what your religion or spirituality tells you, what you should and shouldn't be talking about. And all of that does is it leads to this kind of overall lack of understanding about the disease process. If the adults in the home or the family are really struggling with how to talk about it, and the kids don't know, then we see that the children really have a difficult time dealing with it, because often that parent, that grandparent, that family member is dealing with, kind of struggling with how they deal with it as well. So while it may not be a direct pathway, all of these things do have a play on each other. And in the end, children have said directly they want to know about the illness and they want to hear about it from their family member. So, how do we go about doing that, right? How do we even have this conversation knowing how heavy and really profound and emotionally laden it really is? And in a brief conversation with you all in this presentation, one of the things that I tell families all the time is think about having the conversation when you're doing something normal. You're watching TV, you're playing a game, you're having dinner, something where isn't you aren't super stressed about. You're not going to sit down and have the conversation, because then that raises up everyone's anxiety and everyone's fears and concerns. So think about when you're having a normal everyday moment. Be honest and start with basic information. You don't have to start all the way at the very end, but you need to start with something very basic and open-ended questions. What do they know about ALS? What kinds of things do they want to know? Have they noticed that anything's different about mom, dad, grandma, aunt, whoever it is? And don't hesitate to seek out the experts. And there are several on this call, right? So go to your ALS organization, go to your clinic, go to that ALS multidisciplinary clinic and ask, say, I really want to talk to my kids. Can you make sure I have the most up-to-date information about how I can share this, or what the details are in that I'm sharing with them, right? And don't try to cram everything in all at once. A lot of families come to me and say, oh my goodness, we tried to have this huge conversation and we told them everything all at the same time and everybody just left and we're super overwhelmed. So don't feel like you have to have everything in the same conversation all at once. But what a lot of times happens is that parents, grandparents say, I am not prepared to answer questions. And I'm afraid that they're going to ask me something that's going to really blow me away or stress me away. So something that's important is to stop and think about, how would you like to talk about it? Like, what would make you comfortable? And is that making sure that you've checked in with your ALS organization in advance to say, hey, I'm going to have this conversation with my kids. I just want to kind of run it by you first. I want to bounce off some ideas. Really check in with those care coordinators, check in with your multidisciplinary clinic. But also being willing to show your willingness to have a difficult conversation. Um, Kids really do pick up their cues from the adults around them, and they can tell when you're feeling reticent or anxious. And so they're going to kind of absorb that and respond in kind. But if you say, there's something about ALS that kind of makes you feel uncomfortable, maybe something how it's changed and you're just not quite sure, then that opens the door for them to be able to say, yeah, I'm not sure either. And I feel a little uncomfortable too. Or can I ask you like what this feels like or what it's like to have it change in this way? So obviously before you have those conversations, that's why it's critical to have that comfort conversation first. How comfortable do you feel? Because if you open the door with your children, youth, and grandchildren, right, they're going to go right through and they're going to ask a lot of questions. But don't ever feel afraid to say, I don't have the answer, and we're going to find it out as we go along. And that's another reason why I wrote that book for families, is that there's so much information in there that you can pick through and look at different sections and kind of maybe pick and choose how you want to have the conversation and at what point along the timeline. But aren't I protecting them by not telling them about ALS? And this is probably the most common thing I've heard from families over the years, and not just related to ALS, but really related to any illness. What I always ask families is, why do you want to protect them? Kind of let's think about that. Let's unpack that part about what it is that you want to protect. And often it's because you don't know what to say, which makes perfect sense. So that's where you turn to that trusted source, counselor, therapist, ALS organization. I'm feeling uncomfortable, get some counseling and get some support for before you have that conversation. Maybe you know your child and you know they won't handle it well, and that makes perfect sense. You know how your kids respond, your grandkids respond to certain things. It's a great opportunity to again engage a trusted family member, a friend, a therapist, maybe someone who they trust and they know well that you can bring into that conversation, a school staff, a school social worker, whomever it is. But if the impulse is you don't want them to know, I, I just caution that. I caution that because the internet is the internet, and it's here and it's not going anywhere, and kids can find anything on the internet. And if you're keeping something from them, we have seen far too many times where that builds resentment and isolation in children and families, because then they feel as though their parent or grandparent doesn't trust them, because all they had to do was get on the Google and they found all kinds of stuff that mom, dad, grandma, grandpa was quote unquote not willing to tell them. So think about kind of all of these potential ramifications. And the final key on this conversation is to just talk, have communication, and keep it open. And don't hesitate to bring in those trusted colleagues, those trusted friends, those trusted neighbors, your spiritual advisor, your healthcare workers, whoever it is. Bring in those folks for these conversations. Because when we ask children and youth, like, what do you want? Like, how do you want to have this conversation? Do you want to talk with them? Across the board, they absolutely do. And this is an 18-year-old whose parent has ALS, said, I think just like talking to her is probably the best thing. Just kind of like good communication and stuff like that. So I think having a conversation with her helps a lot. It's just talking about it. And once you kind of, rip that Band-Aid off, so to speak, and start with those initial conversations, they do get a little easier because you're being open and you're being cognizant of how important that is for your child and youth. And one of the things that I've worked with families when I was doing more therapy, more clinical therapy, is really working with families around creating a new normal. Like, what does that mean? And sometimes living with an illness means it's living with it and not in spite of it. And it's not what it once was. And it can be very hard for everybody, including that youth. And so when we talk to youth and ask them kind of how do they process and what does that mean for them, They talk about feeling sorry for themselves, but I also felt feeling sorry for the parent or the family member with the illness. Um, but recognizing that it is part of their family's new normal. So how can you move forward knowing that that's where you are, that you can live with it and not in spite of it? And these are huge, huge conversations. And I honor and recognize the fact that I'm doing this in a fairly short amount of time. But I hope it's little nuggets to help you all kind of think about how to have those conversations if you haven't already, or to help your other family members have these conversations, which are so, so critical with our children and youth. And I want to say in the guide, there's a whole section on having conversations around ALS by age and developmental stage. Because obviously, you're not going to say things to a 5-year-old that you would an 18-year-old. So it helps you think about where they're at developmentally, how they understand, how they process things. So if you have a 5, 7, 8-year-old child or grandchild versus a 15, 16, 17-year-old, then you can look at that family guide and that'll give you some help in thinking, how do I frame these conversations by their age and developmental stage? And one of the big areas that I spend a lot of time on is children and youth who help take care of a family member with whatever illness. And I do a lot of work in the ALS space. But what we don't do writ large, not just in ALS, is recognize the role that children and youth play as caregivers and what can we do to support them. I'm not sure how many of you have a child or a grandchild that helps out, but globally, there are many, many, many millions of children and youth around the world who do all kinds of things to help out a family member. And if there's anything that an adult does, there is a child doing it. So they're helping with medication management, they're bathing, toileting, lifting, transferring, feeding, sometimes just waiting and watching, just kind of hanging out to make sure family member doesn't fall or choke or can, get around easily. So there are so many different care tasks, and children are actively involved in it. And when we ask our children and youth who are caregivers, what are the things you need? How can we help you? What kinds of supports do you need? They told us, this was a qualitative study, and they told us very, very clearly that not only do they need emotional support, so they want friends who get it. They want to be able to talk to their friends about it, right? They want people to be understanding. They don't want people to treat their family like some sort of weird thing. They want them to be normal. They want support groups, but they want to be cared about being a caregiver. And that was pretty profound, because when you think about that in combination of the instrumental support, this is where they want people, they need people to help them with the actual act of caregiving. They want information, they want advice, but they also want respite. They want somebody else to come in and spend time with their parent because they know how valuable that is. They know that their parent wants and needs their own levels of peer support. So it's not just about them as a caregiver. What we also know is that when they're providing care, children and youth, they're not sleeping very well. And this is data from our first sleep study. We have another round that we have 2 papers in process. And all of this jumbled data, pretty data screen, all of this really means is that the kids who are caregivers compared to their non-caregiving age and gender matched peers had more disruptive sleep across days. They weren't sleeping as robustly, and they weren't necessarily getting up in the night to take care. They were just kind of tossing and turning and feeling very thinking and perseverating. So we know that they want to understand about the disease. We know that they're participating in a lot of care, and we know that it might be disrupting their sleep. I'm going to slip that slide. But one of the things that's really important is looking at it, taking it step back, and helping to facilitate the conversation with your children and youth and grandchildren around caregiving. And I know this is one of the hardest conversations because sometimes it's hard to acknowledge that you need care. Sometimes it's hard to acknowledge to ask for care. As an aside, I recently became caregiver to my elderly mother, and that's an interesting transition, right? From mom to, middle-aged adult child. Um, she's now having to say, okay, let's talk about caregiving. Here's the things that I need. So I think about that in the context of what if it was a child or youth? And so anything that we can do, professionals, anything you can do, families, they oftentimes children and youth fear that the care that they're giving isn't good enough because there isn't enough conversation and support around it. So having you all as family members, whoever it is living with ALS, their family members, encourage them to kind of have a conversation about it and let them know that it's whatever care they provide is good and it's helpful and they're thankful for it, right? This is another time for us to keep having conversations around how I feel, what do I understand, how can we talk about care. We also want kids to be able to freely talk about, I don't know, sometimes it makes me feel anxious and it makes me feel concerned about the care I'm giving. This is another level of constant communication to where any resources that we have are going to be incredibly important here because caregiving is not something that everybody talks about freely. So, as a family, what kinds of conversations can you have around caregiving, letting your children and youth know that they're not, you're grateful for that, that it's okay. You can use I feel statements. I feel stressed or worried, or I feel happy that you're helping me provide care. And for our providers on the call, this is a really good model as you're working with families to kind of help them have conversations and help the children know that they are supported and that they are cared for. So all of this, all of this data, all of this research that I tried not to spend too much time on, it really shows that there is a gap of programs and services for children and youth. They need support, they need hands-on guidance, they need peer engagement, they need to be able to talk about it and understand what's going on. And as a result, so I've been doing this work for many, many years. So I started in social work about 28 years ago. And in the past 14-ish years, I've been specifically developing programs and conducting research to create the supports needed for children and their parents and their grandparents. And I'm incredibly grateful because the kind of result of all of that is the nonprofit Global Neuro Y Care. And Global Neuro Y Care really uses all of my clinical experience, my social work practice, my research, partnering with the most amazing organizations here in the US and around the world. So some of them you see off to the right here. There are folks from Colombia, the Netherlands, South Africa, that I just get to work with and figure out how best can we create support programs. And this is our mission: to engage organizations, develop education for children, youth, families, and professionals, and provide support programs. And one of the great things we get to do is that we do work with organizations around the world, including the ALS Association. So I'm going to talk about several programs, one of which is in process now. So lately, I will say in the past, I don't know, handful of years, as we have understood more about the genetic component of ALS, it has become more and more critical to help families have that conversation. And I'm working with the ALS Association in Canada to develop a whole suite of educational materials so that families can have conversations around genetics, around the genetics of ALS. What does it mean to be at risk? How do we talk about that with children and youth across ages? So that's one of our programs that is almost finished. But the other one is the Y Care program. And Y Care has been around. We started it here in Wisconsin about 9 years ago. And what Y Care does is it really attends to all of those gaps in supports that were absolutely identified by research. Lack of support, lack of peer support, lack of information and education about the disease, needing hands-on care about the illness, having people respect and know and identify and support them as a caregiver. All of those things went into the creation of Y Care. And Y Care is a program that is delivered to children and youth, literally around the world, where it gives kids the time to meet with healthcare professionals like Renee, being an SLP, or OTs, or PTs, or respiratory therapists, yay, where they get to spend the day and go through different modules and ask all the questions about care. Show the healthcare providers the things that they're doing to provide care, and then get feedback on how to maybe do it correctly or maybe safely or in a different way. And so the modules that we've created for the ALS program include a module on basic care where kids get to go in, they get to touch all the devices in the room. They can play with anything, nothing's off limits, because we want them to immediately feel comfortable. So they go in, they get to touch everything, and then the therapist says, show me how you use a gait belt. And so the child puts the gait belt around someone, and maybe they put it the backwards way, right? Because there is a right way to put a gait belt on, right? So they put it on the wrong way. And then the therapist says, let me show you the correct way. And then the child gets to test it out again. So we do that kind of a teach back method that gives them that confidence that they're going to do it the right way with the guidance of that healthcare provider who's been trained in the Y Care model. We also have modules on communication and feeding that are run by our speech language pathologists. We have sections on assistive devices where kids get to get into a power chair and move it around and see what it feels like to live and move and kind of breathe in a power chair. We also have respiratory, to where they see what it feels like to have a BiPAP on and what's a correct way. We want to make sure there's no space for your fingers. Is it too tight? Is it loose? That way, when they're with their person with ALS, it gives them that sense of, I have a much better understanding of what you're going through. So when you tell me I'm having a problem with my BiPAP, they have a better understanding of what that might mean and how they can help you. We also really focus on the support program, and the support is woven throughout the whole day. They get lots of support from the care coordinators with the ALS Association. We have social workers associated with clinics, psychologists. Depending on the illness, we have any constellation of professionals who are part of and supportive of the Y Care program. As you see, we've trained over 120 kids across the world. We've done it multiple times in South Africa. We've completely adapted it into the South African 4 languages and context. It uses small groups, where this is a picture of some kids where they just, here's a break. They're sitting around and they're talking about their families and their experiences. It's such a calm, easygoing, natural way. And we have handbooks. So all of the kids get a handbook that they get to walk away with that has pictures of everything, that has details about the modules. They can write the names of the other kids that are part of the program. And we've done it in ALS. We've done it in siblings as caregivers for autism. We've done it in Alzheimer's disease. And then we also just recently did it in our military connected and veteran communities for kids who are caring for someone who have a traumatic brain injury or a spinal cord injury. So we've really expanded it to be as inclusive as possible. And every time we do it, this is like, I'm so proud of some of the pictures on these slides because these are a very small number of our healthcare providers who have been trained in the model and have delivered Y Care to kids literally around the world. So that is the Y Care, and I'm very grateful. I think it's always useful to hear what the parents have to say, and parents really do respond that they see their kids being more confident, and it's helped him be able to process more. So by going through Y Care, getting that peer support, getting that support of healthcare professionals, which is really cool because how many kids have ever sat down and been able to have a conversation with the occupational therapist? Not many, because people aren't bringing their children and grandchildren to clinic. They know mom or dad or grandma is going to see the PT or the OT, but they have absolutely no idea what this person's like. So this also gives them that hands-on experience. The other thing that I'm also incredibly proud of, that is in partnership with the ALS Association, are all of the books. So on my left, I think you're right, I'm not sure, whatever, the graphic novel. So that is a graphic novel, and all of the books are written using all of my research, all of my survey data, all of my interviews with children and youth around the world about their needs and experiences. And so the graphic novel is for young children. It really goes through what is ALS? How do I talk to my friends about it? I'm a caregiver. How do I get support? What's that like? And also in this book and all books, we don't shy away from death and dying. We don't shy away from the fact that people die with ALS. And we can't say when or how, but it's part of it. And we have an entire chapter on helping kids kind of understand that. We have a book for school personnel. So if you have a grandchild or a child, you can bring that book to their school so that their staff have a better understanding of what their child might be dealing with and managing at home. We have a book for young adults. This is a really big issue. You know, once they get 19, 20, 21, 22, are they going to go to school? Are they going to have kids of their own? Are they going to get married? Are they still caring for somebody? It's a really complex time. And then we also have a book for kind of those tween kids. That's somewhat awkward, like 12 to 15, where they're just trying to figure out who they are in the world. And again, all of these books use the real voices and the real language of children and youth across ALS locations. And the last big thing I'm going to talk about is Lukey and the Lights. And Lukey and the Lights is an animated short film, and there are no words. And I'm going to play it for you in just a minute, but there are no words with Lukey and the Lights, and that was absolutely intentional so that kids around the world can feel support and can understand what's going on in this film. And Lukey is a robot. So you'll see over here, he's sitting in his wheelchair. He's a robot and he gets ALS, but he's also a robot that happens to be covered in light bulbs. And as ALS progresses, his light bulbs go out. So it's a visual experience of seeing and kind of watching the progression of ALS through watching Lukey's light bulbs go out. We have educational materials for Lukey and the Lights. You'll see up in the right-hand corner, we have a coloring and activity book. And I actually, the call right before this one, I was on a call with a woman who has ALS, and her niece is 5 and just watched Lukey and the Lights, and she gave her the coloring book, and she wanted to watch it again because she wanted to follow along with her coloring book. So she opened up the coloring book, and the book does follow along. So there's pages to color of Lukey that are happening in the film. Then there are activities where we ask the kids, like, how do you take care of somebody? Do you assist in care? How do you feel about that? And as you can imagine, at the end, there's a whole section on death and dying and loss. And how do you feel about that? Again, we aren't shying away from that because that is part of this. And so all of these materials are available on our Global Neuro Y Care website. A lot of people ask, how did this come about? So I wanted to put in kind of like an information slide. So a couple in the Netherlands, Sasha Groen and Anja Snijders. Anja was diagnosed with ALS at the age of 35. They had two young children, and they were trying to figure out how to explain ALS. And they found me because the graphic novel that I wrote had just been translated into Dutch. And so they reached out to me and said, we want to do a film. We have this idea. Will you partner? And it's been an amazing, wild roller coaster. But Big Grim Productions, which is an actual LA animation studio, created the film. We worked really closely to kind of make sure that we're attending to all the needs of how ALS progresses, how we show frustration, use of assistive devices. And so the film is available now on our website. I'm going to go on our website in just a second. But we also have the coloring book, as I said. We also have another whole packet of educational materials. And it's down here where it says Ask Lukey. There's a whole section in the educational materials that help kids understand more about ALS through the voice of Lukey. So it's as if Lukey is answering their questions. So we have a whole list of questions, and the responses are as Lukey would give them. And we have them for young children, and we also have them for older children. So I'm going to close out my PowerPoint.